Muan has just come into the world. Like some children in rural areas, he was born at home rather than in a hospital. His mother, Rua, an ethnic Krung, doesn't speak Khmer and earns a subsistence living farming rice in a hard-to-reach village in Ratanakiri province. In this remote province, 1 in 30 infants dies in the first month of life. 1 in 12 does not make it through their first year. And by age 5, 1 in 10 children dies mainly of preventable and easily treatable diseases such as diarrhea and pneumonia. But Cambodia is taking steps to increase Muan's chances of survival. Ongoing improvements to the health system in rural areas are making access to timely and appropriate health care available for many more women and children. In the last 10 years, impressive gains have been made in Cambodia on key health indicators for mothers and children. The infant mortality rate has been halved and the under 5 mortality rate has also greatly declined. Vaccination coverage for children has doubled, and the number of women giving birth at a health facility has gone from 1 in 10 to 1 in 2. Cambodia is now working to ensure that the most vulnerable children are being reached: poorest, those in remote areas, ethnic minorities, migrants, and mobile communities. Infant mortality amongst the poorest 20% of Cambodians is 71% higher than the national average. And infants born in rural areas are 3 times more likely to die during their first year of life than infants born in urban communities.
Chỉ chôn phía tây nâng chỉ chôn đại là tìm nơi nhọn ban từ tua nơi xây và sọc phía tây chiang bị chỉ chôn đại luôn nơi thị trấn rư co bị chỉ chôn đại luôn nơi tam tìm bị chôn ca đó xây và mùa than trời ban từ tua sọ thà chia sạc cầm phía trong bách rồi bỏ xuống sọc khăn và làm bay ao từ đó chỉ chôn càng này ca chốt đó xây và mùa than cua tài nom dột nâng xây và xem tiết để tẹt tông tới nâng sọc phim bị đa tiệt ruột nâng cù mà phòng đại đôi khi ca bệnh viện cũng nào ca bị nâng tây pua ca bị nâng cào sầm ra ca thay tông tiệt ruột prom đen ca đoปลอก năm chi chiết a nâng 5 ตุ่มแบบพรุนดังกูมาเชียร์จนพวกการอบรมสองพีบกเลิกเราสองพีกลัวเพื่อสาการชิมวยนั้นแดดสมาร์ทภูมิอบรมดาวประชาชนเรียงปีรูปสัญญารุทนะในจงเงินเรียบร้อยหนังหาพร้อมแต่งการของครบจิตตึกดาวกูมาได้มีจงเงินเรียบพร้อมมา
เรื่องกองยำสลับมูลเหตุมนตมงดาวดุนจังนะดาวดุวิริยรีนักยำอันมินเลยตัวเพบาลโกนเนาะปรังแต่ดำชื่อดำไอ้กูอ้อยโกนพักหาวเป็ดเนี่ยหาวมิงเกินเนาะก็ด่าสรูมได้ด่าอับตอนรีเนาะบางเนาะมาเพย์ปีไงรีกระดาวงับอันมินเลยตัวกลางมินเป็ดทอมอ่ะมินไอ้ปลุกมาได้บาดไอ้ตัวตีตัวอ้อยโกนงับนี่นะมีสไลเนาะดาวให้กรุนเนาะวิกไอ้ปูวินในเรื่องโดยธรรมะจังไอ้ปูตัวเป็ดลูเป็ดก็หาเป็ดวันเป็ดรอดเป็ดจอนเนาะจ่ายดันเนาะเป็ดเนาะตกบาดตีดวัวโกนมาวิ่งยุบนั่งงอบโกนนะ
พิเศษขนาดไหนกันดีคือการไปชอบมีปีตีมวยคือแตะตองจมูกนั่งแนบดาวเสวาตีปีคือแตะตองจมูกนั่งแนบตัวเสวาแนบดาวเสวาเราบางยังยอมในน้องขนาดไหนกันดีปัจจุบันนี้กำรัดในทนเทียนมนุษย์คือน้ำเมงกำรัดเทียบในลายมันกรบติดใบยื่นเปรียบเทียบจมูกนั่งสักดานุปโภลบานไปเจจนสารบเมียนดับผมเปิลเมินปีความปรามรอยสายแต่ผมใบเนี้ยปันตายไปเจาะมันดัดเมียนเหมือนตอนบานมาไพ่เนี่ยพอได้ไล่ชมอบได้จะชมอบจุ่มเนียงคือเหมือนตอนมากรุบกรอนในลาย
Providing healthcare to remote and high-risk communities is expensive and the resources available are scarce.
ដួលសុខភាពសម្បូរស្ថិតនៅចម្ងាយពីទីរួមខេត្តកញ្ចេះប្រមាណ36 គីឡូម៉ែត្រហើយគ្របដណ្ដប់21ភូមិក្នុងនោះមានភូមិឧបសម្ព័ន្ធចំនួន15ហើយផ្នែកខាងដីគោកមានតែ6ភូមិទេសល់ប្រមាណសិតដីកោះនិងកោះធំនៅឆ្ងាយពីទីរួមស្រុកនិងដួលសុខភាពហើយមានប្រជាជនចំនួន 23,180 នាក់មានបុគ្គលិកមណ្ឌលសុខភាពចំនួន19នាក់ក្នុងនោះអត់មានវិជ្ជាបណ្ឌិតទេមានតែគ្រូពេទ្យម្នាក់ហើយសល់ប្រមាណមានតែឆ្មបថំនិងគិលានុបដ្ឋបឋមធ្យមខ្លះប្រជាជនក្រីក្រហ្នឹងមិនអាចមកនៅមណ្ឌលសុខភាពបានដោយខ្លះខ្វះលុយកាក់មកថវិកាក្រខ្សត់ពេកអ្នកជំងឺអ្នកមានផ្ទៃពោះមិនអាចវិលមកមណ្ឌលបានមុំធ្វើដំណើរពីក្នុងព្រៃចូលដល់មាត់ទន្លេហើយខ្វះមធ្យោបាយជួលទូកកណោតគេទៀតហើយមានរថយន្តមួយគ្រឿងដែររថយន្តនេះក៏មិនអាចដំណើរការបានដែរដោយមណ្ឌលសុខភាពគ្មានលទ្ធភាពជួសជុលហើយសម្ភារៈអីខាងនេះទឹកភ្លើងអីក៏ជួបប្រទះសពបែបយ៉ាងភ្លើងក៏អត់មានទេគេឲ្យតែ10គីឡូក្នុងមួយខែអញ្ចឹងទៅដល់អញ្ចឹងទៅយើងប្រើគ្រប់ទេប្រើគុយសូលាអញ្ចឹងទៅ
The situation at the Sambo Health Centre repeats itself in several other areas in Cambodia. It is also a challenge to get people to use the services once they're in place. Poverty, traditional beliefs, linguistic barriers, and social stigma sometimes discourage remote and ethnic populations from seeking health care.
គាត់ថាពេលអ្នកភូមិទាំងអស់គ្នាគេចូលចិត្តដូចគ្នាទៅពេទ្យប៉ុន្តែពេលណាដែលត្រូវទៅនឹងអត់មានប្រេងក៏អត់បានទៅអញ្ចឹងចង្ការឈឺពេលយប់កើតនៅផ្ទះទៅពេលរសៀលបានទៅដល់ពេលនឹងខាតខ្លាចកើតកូននៅទូកគេក៏អត់ហ៊ានយកទៅក៏កើតនៅផ្ទះទៅព្រោះថាយើងយកទៅខ្លាចកើតតាមផ្លូវគេផាក់យើងឈូកមួយហើយនឹងស្រាមកពីងចាគេលៀងដើម្បីលៀងទូកគេអត់មានការចង្រៃអីគេបោះគេ
Recognizing the barriers faced by the poor, ethnic minorities, remote and mobile populations, UNICEF has been working with the Ministry of Health to identify and develop ways to address these unique problems. Mapping the community to identify vulnerable households, encouraging community care of mothers and newborns, establishing emergency referral systems managed by commune councils, and promoting integrated health outreach activities are all helping to ensure that essential maternal and child health services reach the poorest and the most vulnerable. Volunteers and integrated outreach services play a critical role in reaching and supporting communities that have limited access to services at the health facilities. Community volunteers around the country are receiving extra training and supervision to provide them with the knowledge and skills to help improve healthcare-seeking practices in their villages. Taught to identify danger signs in pregnancy and for childhood illnesses such as pneumonia and diarrhea, they are working to make sure that children and mothers get referred on time to health centres or hospitals.
បានតែខ្ញុំសមាជិកធ្វើជាអ្នកសុខភាពភូមិខ្ញុំចង់ឲ្យប្រជាជននៅក្នុងភូមិនឹងមានសុខភាពល្អចាដើម្បីមានការរីកចម្រើនទៅពេលដែលខ្ញុំចូលអប់រំប្រជាជននៅក្នុងភូមិប្រជាជនមានការរីកចម្រើនច្រើនយល់ដឹងច្រើនដូចជាពេលទៅសម្រាលកូនអីចឹងគាត់លេងសូវសម្រាលនៅថ្មបុរាណហើយគឺគាត់ទៅមណ្ឌលសុខភាពទាំងអស់គ្នាហើយការពិនិត្យផ្ទៃពោះក៏អញ្ចឹងដែរចាស់ដូចជាពេលទៅពិនិត្យផ្ទៃពោះគឺទៅហើយនៅពេលដែលសម្រាលកូនគឺគាត់ទៅដោយឯងចាខ្ញុំត្រេកអរណាស់នៅពេលដែលគាត់បានធ្វើអញ្ចឹង
In addition to training volunteers, Cambodia is also improving the quality of services provided at health facilities serving remote and marginalized populations. Nu Vichetra has been working as a midwife for 16 years. She heads up a team of midwives that use innovative approaches to meet the needs of marginalized populations.
ដោយថាអ្នកក្រីក្រដែលគាត់ត្រូវនឹងមកជួបខ្ញុំហ្នឹងគឺអ្វីទៅដែលខ្ញុំអត់មានគិតថាប្រកាន់តំណឬដូចថាគាត់លើអើងគាត់ណាចាគាត់គ្មានលុយមានកាក់នឹងគាត់ចូលមកប្រើសេវានៅនេះខ្ញុំអត់មានគិតទេហើយម្យ៉ាងទៀតគាត់នឹងមកបានមកតែម្ដងអញ្ចឹងហើយក្រោយគាត់នៅមានអារម្មណ៍គាត់នៅចង់មកទៀតដោយសារគាត់ទៅដល់គាត់ផ្សព្វផ្សាយទៅតាមសហគមន៍របស់គាត់ថានៅណៃនេះពេទ្យទាំងដូចថាមិនឬអើងហើយគាត់ដូចថាជាប្រៃគាត់ចិត្តទទួលរាក់ទាក់អីចឹងណាព្រោះសេវាខ្ញុំនៅកន្លែងនេះខ្ញុំទទួល24ម៉ោងតែម្ដងទោះដីថាខ្ញុំបុគ្គលិកខ្ញុំអត់នៅគឺខ្ញុំមានកម្មករមួយគាត់នៅចិត្ត អញ្ចឹងគាត់អាចតាក់ទងតាមលេខទូរស័ព្ទអារឿងពីអរញ្ញវិទានអីហ្នឹងហើយទទួលចំណូលពីអតិថិជនមកហ្នឹងវាមិនអីជាច្រើនទេវាតិចតួចបំផុតក៏ប៉ុន្តែម្នាក់ចិត្តតែមានឆន្ទៈខ្លួនឯងតែម្ដងផ្ដល់ជាមេរៀនល្អគឺសំខាន់បំផុតពេទ្យគឺត្រូវចេះរាក់ទាក់ចារាក់ទាក់មិនប្រកាន់វណ្ណៈហើយឬអើងហើយមួយទៀតយើងត្រូវប្រចាំការជាប់រហូតរាល់24ម៉ោង
Volunteers like him Tompor and midwives like Nuvichetra are overcoming the barriers faced by marginalized populations. However, if real progress is going to be made, good practices like these need to be replicated throughout rural, remote villages in Cambodia. Achieving this requires 3 specific actions. Good health service planning at province, district and commune level to meet the needs of remote and marginalized populations. Training of more community volunteers in rural and remote villages. The availability of emergency transportation to get mothers and children to health facilities for timely and appropriate health care. If these steps are taken, baby Muan and many other children like him can look forward to a healthy childhood.